In recent weeks, the COVID-19 pandemic has shed new light on racial and ethnic disparities in Minnesota. According to the state health department, communities of color and indigenous communities have substantially higher rates of health inequities. In tonight's Voices for Change, Fox 9's Bisi Onile-Ere speaks with the CEO of Northpoint Health and Wellness on the steps being taken to help close that gap.
So Minnesota is considered one of the healthiest states in the country, yet has one of the largest health disparities when it comes to people of color. Why do you think that is?
Well, the reason that there's such a large health disparities for people of color is because there is the underlying cause of racism, but then there's also large disparities in wealth. There's also disparities in education. So when you have these disparities in economic and social factors, all of that impacts health. We talk about the social determinants of health, and I also talk about the political determinants of health. So those social factors really impact health outcomes.
So how do you address those disparities? What do you have to do to get those numbers to go down?
If people have safe, affordable housing, if people have access to healthy food, people have access to parks, good schools, all of that impacts their ability to have health outcomes. So addressing those.
And can you explain how systemic racism presents itself in the healthcare system? What does it look like?
Systemic racism really looks like policies, access that work for one group of people and not for another, right? So oftentimes they're behind the scenes. People don't necessarily see them, but they do show up and they do impact someone's ability to have good health and health outcomes.
So COVID-19 has really exposed some of the health inequities for people of color. What have you seen here at Northpoint?
Yep, so we've seen the same thing, and we were not surprised that there would be the disparities in the COVID-19. In Hennepin County, when they've looked at the rates and they've adjusted them for age, they've seen that there's, for African Americans, COVID cases 6 times the rate for whites, and for Latinos, it's 4 times the rate for whites, and for American Indians, it's 3.5 times the rate. The testing is important. We want to be able to test more people, to test people not only that are symptomatic, but you also need to test people who are asymptomatic. In order to do that, you got to have enough supplies. I mean, the reality is that in this country, in this state, we don't have access to enough of the supplies to be able to open up that testing to everybody. So the testing right now is restricted to those who are having symptoms. We know now that there's probably at least 40% of the folks who are infected are asymptomatic. We believe that we've got to do a better job of outreach and communicating that message to our communities.
Hennepin County recently declared racism a public health crisis. Do you think these types of declarations are enough to actually spur change?
Declaring it as a public health crisis is the beginning. It's not enough. It's not one where, okay, we've created this declaration and then we're done. No.
Northpoint has been around for decades. As we see this movement evolve, what are your next steps moving forward?
Well, our next steps were for sure working as a strong partner with the county and making sure that we address racism as a public health crisis, but also how do we ensure that the information that we have learned about working in communities of color, working in African American communities, is one that is shared more broadly. It is also for us to make sure that the disparities that we see that we're able to serve as a model on the type of interventions that it takes to decrease those disparities. And we've learned a lot about that by understanding better the culture of the people that we serve and making sure that in the way that we develop interventions around improving health, that it includes that, of the culture, the beliefs of the people that we serve. And we want to make sure that, that we are spreading that more broadly.
Stella, thank you so much for sharing your perspective.
Thank you for the opportunity.